You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Saving lives by selling collars, scrunchies, and swag. Please check out Bark and Wag's website, barkandwag.com. That's BARKNWAG.com to see the awesome merchandise. Bark and Wag collars and leashes, collar covers, and decorative bandanas are perfect for your pooch. For the owner of the house, we have t-shirts, sweatshirts, long-sleeve shirts, hats, and even coasters. We are expanding monthly, so be sure to check back. We love pooch ideas for podcasts and merchandise too, so send an email to polly@barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Millie Armstrong, owner of Pettybrook Veterinarian Clinic in Vermont. Welcome, Dr. Armstrong.
Hi, Polly. Thanks for having me.
Yes, thank you for being on the podcast. I wanted to have you back to talk about the influenza flu vaccination. I did not know there was such a thing, and I wanted to find out more.
Well, thank you for having me, and that's a good thing to talk about because the influenza virus is a respiratory virus that affects just about every species, dogs, horses, people. We hear about it a lot with swine flu, the bird flu, avian influenza, but it actually can affect multiple species. Each species tends to have their own virus, but this influenza virus is one of the viruses that can mutate very quickly and tends to cross into different species to create illness in the different species. So that's why we worry so much about swine flu infecting humans or avian influenza affecting humans. And where the dog flu virus is concerned, that actually originated as an equine version. It was originally in horses in Florida, but the virus mutated and began to affect dogs in Florida. And then the virus started to move up the East Coast as people moved with their dogs or the rescue dogs came further north. They were carrying this virus. It began a more problem all up the East Coast, and now it has actually spread across the United States. We're seeing outbreaks in multiple cities around the country. What the virus does, because it's a respiratory virus, it infects the cells that line the respiratory tract and causes a lot of irritation and inflammation, which we see as a pretty deep, harsh, hacking cough, and maybe even a discharge from the nose, sort of the yellow, mucusy, what I call snot nose kind of discharge. And it can cause dogs to run a relatively high fever. Normally the temperature for a dog is about 101 to 102.5, but dogs with influenza virus can run a fever up to 104, maybe even a little bit higher, which really makes them feel lousy.
Oh, I can imagine.
And yeah, it can cause quite a bit of trouble for them. So as they're coughing, they obviously aren't eating well. It can be a little confusing whether the cough is caused by the influenza virus or the other respiratory complex infectious agents that can cause what we normally call kennel cough, like the Bordetella bacteria and all these mycoplasms and other things that can cause, in quotes, kennel cough. So it's hard to know the difference sometimes. So if your dog is beginning to cough, get it to the veterinarian, because any other number of things can cause coughing too. Heart disease, parasites, heartworm disease. So there are lots of reasons for coughing, but we don't ever want to take that lightly, and please get your dog to the veterinarian. The way we manage influenza virus is we have to try to prevent the secondary infection from developing pneumonia within the lungs, because these dogs can develop pneumonia relatively quickly. So we want to get them on an antibiotic, possibly use cough suppressants, something to maybe get their fever down, support them with fluids so they don't become dehydrated, good supportive nursing care. And sometimes these dogs actually have to be admitted to the hospital for a day or two or longer to help them breathe in an oxygen cage or on IV fluids, IV antibiotics. So we want to nip it in the bud very quickly and try to prevent it from getting that advanced to where they're so sick that they need to be hospitalized. There is a way to prevent it. There's a vaccine out there for dogs for the influenza virus. We actually now have 2 strains of the influenza virus. And you hear that argument when people are getting their flu shot. People, well, I don't know what strain to get. What if it's not the same strain as what the infectious strain is going around right now? Well, luckily, the dog influenza virus has tended to be either one of these 2 strains. So there are vaccines to help protect against the 2 most common strains, but that doesn't mean that there may not be another mutation and a 3rd strain may crop up. Like any vaccine, we're trying to protect the dogs from developing severe disease. It may not prevent them from showing symptoms if they're exposed, but they may not develop the severe symptoms, the high fever, the snotty discharge, the dehydration to the point where they actually have to be hospitalized. So I would definitely recommend dogs get the vaccine if they have a lifestyle where they could be exposed to this virus. And that would be the same lifestyle that we would vaccinate dogs for kennel cough. So dogs who go to obedience classes, doggy daycare, the dog parks for sure, some groomers, training sessions, things like that, and boarding, of course, at the kennels. I would definitely talk to your veterinarian whether or not your dog would qualify for the vaccine or be someone who should be protected. Not every dog is coughing when they're actually shedding the virus. So you don't know if the dog is infectious because it's going to come up, wag their tail, look at you. They don't begin to show until after they've stopped shedding the virus. So a normal, happy-looking dog may actually be very contagious. So it's hard to know if your dog is being exposed when it's at the dog park running around with all the other dogs in the park, because those dogs may actually be shedding the virus. So talk to your veterinarian, try to prevent the infection by avoiding situations where they could be exposed. Consider the vaccine and consider also talking to your veterinarian about which strain of the virus they're protecting against, because there is a vaccine that has the combination for both strains in it. So that might be something to consider. It's a 2-booster vaccine. Like any vaccine we give, the first injection doesn't necessarily mount a full level of protection, and we try to booster that about 3 to 4 weeks later, depending on the vaccine, to make sure they're fully protected. If they don't get that booster, they're not going to be fully protected. So you can't, you don't want to have a false sense of security and say, oh, I'm going boarding next week, let me start that series today. That won't fully protect them at the kennel next week. So definitely properly and talk with your veterinarian about what works best.
I just have a quick question. So living in the mountains where we are, at 10,000 feet.
Mm-hmm. Would that be,
yeah.
I don't affects the virility of the virus. I don't think I can answer that question for you. I guess I'd have to maybe talk to your local veterinarians out your way and see what their is. I know that there have been outbreaks in our area. I'm in Vermont, and we had a pretty bad outbreak, 6 years ago now, I guess. It sort of caught our area by surprise. We weren't expecting it this far north. We'd heard about it in the transatlantic states or the mid-Atlantic states down around the Baltimore, Washington, D.C., Philly area. And then I believe a group of rescue dogs came through there or from the south, and came to one of our local rescue areas, and then sort of was the point source for a massive outbreak here in the area. So we had a problem with one of our local daycares. They actually had to shut down for a couple of weeks while they completely disinfected their facility, which was a real hardship for them financially, but also for everybody who was planning on the daycare to be able to have a place to take their dogs. So I kind of look at it like the norovirus, when you hear about the cruise ships breaking out with the GI problems and they have to get everybody back, and then you see people wiping down that entire ship. That's kind of the same scenario when we're dealing with the influenza virus, because it's really nasty and very contagious, and it makes these dogs pretty sick. So try to prevent it if you can, is my. And then the other question is, how do we diagnose it? Well, it can be tricky to diagnose. There's a swab we can take from the very back of the throat near the tonsil area from the dogs, but it takes a while for that culture to grow out, And in the meantime, we still need to start treatment because we don't always have time to wait for those results before we need to get them started on their treatments to give them some relief.
Yeah, and I guess if people are bringing their dogs to doggy daycare from Denver and the dog's exposed in Denver, it's not going to matter what altitude you're at.
No, probably not.
Yeah.
The survival rate of these viruses, I know they're very hardy as long as they're moist in the secretions or the sputum from the mouth. As long as they're moist, they're very viable. And so even dogs that sort of, if you get moisture on your pant leg, you could bring it home. So shelter workers have to be careful that they're not inadvertently spreading it from dog to dog to dog as they're going through their facility. And so I always tell people, make sure you wash your hands really well before you start eating. I don't know if this virus is going to mutate and affect humans, but I take the influenza virus pretty seriously because we know how tricky that virus is, and it's really sneaky, and it can do so many things. And the mere fact that the dog virus began in horses, I think is pretty scary.
Yeah, sure. Well, thank you very much for being on the podcast and letting us know about the flu shot. I'm definitely going to talk to my vet about it.
Absolutely. Well, thank you.
Okay, well, we look forward to having you back on the podcast.
Great. Thank you.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.